Thank you so much to organizer. I'm going to talk to you about my presentation. Well, the head topics of my presentation are the goal of my study, the brief introduction on BSc concept, the results, and the conclusion of my presentation. Well, the goals was to understand how the use of the BSc, the Valence Scorecard, could support nurse managers during their function. Papers available through library database PubMed or Google Scholar are considered in English language. Full test or free full test from 2007 until 2021. The literature review focus upon volumes, journal articles, research reports, library database, and Google Scholar were used with key terms such as BSc, nurse management, organizational management, and nurse leadership. Overall, 16 papers were finally analyzed from 153 selected from reviews. Well, what about Valence Scorecard? Well, imagine, look at the picture. Imagine that you are flying an airplane with only one or two indicators: airspeed and heading. The plane seems to be flying in the right direction and with the correct speed. Unfortunately, the airplane dashboard does not contain information about altitude, fuel, cabin pressure, or other key indicators. Is it really possible to operate the plane if you do not know at what altitude it is flying or how much fuel is left? Well, healthcare organizations face the same type of problem. For example, the return of capital mortality rates or patient satisfaction levels is not enough information for healthcare system or healthcare leaders to understand their operating issue. And it is for this reason that it's important in healthcare organization to have a complete pictures. Here, the BSc can represent a useful navigation tool that can be used inside the healthcare organization. At the beginning of the 1990, Robert Kaplan and Nolan Norton developed this particular model, these particular tools called Valence Scorecard. This is a particular concept for measure, documenting, and managing specific activities of a business or an organization with regard to the implementation of its vision and its strategy, with the intention of balancing the four perspectives of the services. These models, it is organized around four distinct perspectives: financial, customer, internal, and innovation and learning. The name reflected the balance provided between short and long-term objectives, between financial and non-financial measures, between lagging and leading indicators, and between external and internal performance perspective. Financial measures are generally lagging indicators of a company financial status. This is they tell management how things have been going financially with the company. For example, healthcare financial measures include payer mix, debt per bed, cash flow to total bed, current ratio, day cash on hand. Financial measures are indicators of how well things have gone in the past. The customer perspective focuses on such generic measures as satisfaction, retention, market, and payer mix. Internal business indicators on the Balance Scorecard focus on internal processes that have the greatest impact on customer satisfaction and achieving their organizational financial objectives. In other words, indicators included on this perspective report on processes that impact the first two Balance Scorecard perspectives, financial and customer perspective. Then we have learning and growth indicators, identify company infrastructures that create long-term growth and improvement. And there are three sources for growth and improvement: people, system, and organization procedures. Well, the complexity that characterizes healthcare companies also related to its multidisciplinary and multi-professional natures lends itself to the use of measurement tools aimed at performance management, such as the BSC. The transposition within the no-profit companies of the BSC required an integration of the objectives ascribable to economy with those attributable to equity and clinical governance. Within companies that do not identify their institutional purpose in profit, the BSC models itself to the organizational reality, while at the same time providing for a substantial alteration of the references architecture. For example, the economical financial perspective is replaced by the institutional mission. The customer perspective is considered not instrumental to achieving economic and financial objectives, but strictly related to the company mission. The strategy remains as an element of considerable importance, as it is based on priorities defined at a strategic level. And the analysis of the corporate mission and vision decline on specific organizational responsibilities. We proceeded with the identification of the key performance areas or priority areas through which to measure performance level on which it is not possible to foresee bankruptcy action, and making them explicit through the drafting of the strategic map. This last graphic representation of the identification of a cause-effect relationship existing between the areas considered, identifying variables and relationship and incident relationship and performance levels. These reports must be verified and quantified in order to develop the key indicators which are important in monitoring the achievement of the previously defined performances. Within a healthcare company, the BSC integrates the traditional budget system and allows the individual employee to internalize the business strategy, and it is so important for the healthcare system. The BSC is so important for nurses. Why? Well, modern nursing has become a multidisciplinary career that encompasses a number of roles and requires more expertise than ever before. In modern nursing, there are a number of stakeholders like patients, family, the community, insurance companies, governmental agency, administrators, colleagues, staff and physicians. Healthcare solutions in 21st century require a collaborative effort that remain focused on continual progress toward customer service and satisfaction. And the BSC has been a prominent innovation in strategic performance measure system. The healthcare sector has long since adopted this approach to address the complexity of the system itself. And now nurse managers use this model in an interactive or diagnostic way, and its subsequent effect on strategic goal achievement. Both technical design of BSc and good dialogue with hospital staff are important for achievement of multiple strategic goals. Again, the BSc strategy map and dashboard provide leaders, nurse manager, nurse leaders with a visual picture of their specific performance. The cascading principle intrinsic to these particular tools, this particular model, which helps the healthcare system, the healthcare providers in goal alignment at every level of the organization, also brings the need to develop goals and objectives that meet the organizational overarching mission and vision, supporting nurse manager and their staff. The BSc could improve leaders' accountability, a much needed element in the nursing and healthcare system. In fact, the use of these tools is associated with an increase in accountability levels. And accountability is one of the key elements needed in nurse leadership in order for nursing leaders to influence quality and safe patient care outcomes. And also, we can use BSc for different possibility of application. We can use BSc in a different field. We can use in the field of human resource for attracting, retain the best nursing professional, in the field of care delivery and clinical practice. What about the outcomes? Is so important in this field. We can use in the field of nursing organizational capabilities, for example. It is so important for the assessment of organizational performance against targets, and allows for changing circumstances is essential for monitoring and evaluating nursing performance. Well, to summarize my presentation, BSc can help surely nurse managers to enhance clinical and incorporate governance of their units individually and the hospitally. And the BSc can help nurse manager to realize strategy and accountabilities into action. Can be used to manage the nursing strategy plan by improving nursing processes and organizational capability based on data and transparent communication of performance results to key stakeholders. Nursing leaders instead who embark on developing on refining strategy and approach to measuring nursing performance are encouraged to engage key stakeholders so that measuring nursing performance with these particular tools, these particular models that can really represent the difference in the healthcare system to supporting nursing process.